Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
What is pseudoproptosis? In pseudoproptosis, in reality, there is no forward displacement, but the eyeball appears to have been proptosed. So, what are the examples? It occurs due to high axial myopia, or it can occur whenever there is shallow orbit due to craniofacial abnormalities, or it can occur whenever there is retraction of upper eyelids or anophthalmos of the other eye will result in pseudoproptosis.
thank you and thank you for watching.